Hello and welcome to Springboard, a virtual university. My name is Albert Ocran, welcoming you on behalf of Team Springboard led by Comfort. This is your most inspirational show and that place where the greatest minds in the world converge. Springboard is brought to you by the Springboard Roadshow Foundation and proudly sponsored by MTN Pulse Just Be, the Enterprise Group Enterprise Your Advantage, UMB Bank, celebrating 50 years in banking and Central University, Ghana's premier private Christian university. Our media partners are the Multimedia Group and the Graphic Business. So we've been exploring for some time now, making progress in various areas of our lives, spiritually, financially, professionally. We've even done mental health for a bit, but today we settled down on managing your health and wellness. I have a feeling that's something that many of us will be very interested in. My guest today is a medical practitioner. Is it medical doctor or medical practitioner or both?
Well, same.
Medical doctor, management leader, motivational coach, and a minister of the gospel. Dr. William Okyere-Frempong. William, good to see you.
Well, it's good to see you once again, Reverend. And it's a joy to be on Joy with you.
Yes, it's a blessing to be on our various platforms, bringing life and hope, especially at a time like this.
Absolutely.
So William, we've been looking at how to make significant progress by a set of deliberate choices. And really, our focus this year has been on the fact that something you do this year can put you on a springboard for the next 10 years. And we'll be looking at the health component. But before that, tell me about your recent Desmond Tutu Fellowship. I've been following the earlier one with the Hubert Humphrey one on public health that took you away from Ghana for, is it 2 years or a year? A year. But this Desmond Tutu one, I have a very special interest. I'll tell you later.
All right.
Tell me about that one.
Well, so this, I had the privilege of being selected amongst a cohort of 24 amazing young African leaders for this ethical leadership development program. Of course, it's named after Archbishop Desmond Tutu, who unfortunately for our cohort, we didn't get to meet because he died a few months prior to the commencement of our fellowship. But it's a 6 months period where we have an inception in Cape Town, South Africa, and then we have the closing in Oxford University. So in between we have virtual engagements, but it was deeply enriching. Because for me, I find that the summary of my life's purpose statement is to be an enabler of leaders and an apostle to nations. And so coming into contact with and of course you described me as having an eclectic background, whether as a medic is with people are the center. So how do I add value to my people engagement? Whether it's in ministry, it's about people. Whether it's in the space of personal development, is still about people. So equipping myself to first lead better as a management leader myself, and also to serve the needs of the community that I serve better. It's always a welcoming opportunity for growth for me. So yes, the Tutu Fellowship was amazing. It added a different breadth to the depth that I've been building in the leadership development space.
Right, I thought I had a very special affiliation or interest in that one. Before I began, I did the African Leadership Initiative, West Africa Fellowship, and a few other fellowships, a few other platforms that I'm on. I had the same invitation 17 years ago.
Oh, you don't say.
And it's very special for me because it opened my eyes to the reality of the choices we make and how they can either help us to move forward or not. At that time, I was CEO of our own company. We were doing very well. I mean, I didn't even have a CV. I'm sure you asked me for a CV.
Yes.
I didn't have a CV then. And they reached out to me and said it was the last day of the nomination.
Oh
and
dear.
People kept insisting I must be on that fellowship. So they sent
dear.
me a request and said by 5 p.m.
You should send it.
Send your CV. I sat down and hurriedly put together a CV that I hadn't written and sent it. And right after I clicked send on the email, I started noticing mistakes in the CV. And I knew it wouldn't go well. And I got a call from a very well-spoken lady the next week, and she said, "Is that Mr. Ocran?" I said, "Yeah." I said, "That was a very brilliant submission you made. So many wonderful things you are doing." And all I was waiting for was "but." She said, "However," when you hear but, nevertheless, however, notwithstanding, you know the Chalanko. And she said, "Oh, it was very competitive and you were not selected." Talking about preparation, what must Africa and by extension Ghana do, or what do we need most?
Without wanting to sound as having a cookie cutter solution to the problems, I would say that I think I'll put it in one phrase, that we need effectual leadership. And how do I disaggregate that? Four features. This is leadership that has the capacity to envision, and so it is competent, it is visionary, it has foresight, has the technical capacity, and then it also leadership that is ethical. Because at the heart of, especially in most developing countries, the challenges that we face, and our country is no exception, is one of corruption. And if many suggest that if we're even able to solve the corruption, the problem of corruption, that we would even have more funds to undertake some of the developmental projects we need to execute. And then there is an issue of execution. We are blessed with, leaders who can envision, but I think we haven't had the leaders who have had the ability to transition from communicating vision into execution. So there's a lot of lofty ideas on paper, strategies that we are discussing every time. We need to do this, we need to do that. But the capacity to translate vision into action, execution, is lacking. So execution and evaluation. Obviously, if you execute, you must be evaluating whether what you're doing is bringing the results that you originally intend. And the last one would be empathy, where leadership is people focused, because there must be a connection between the leader and the led. If that kind of empathy, that kind of trust, that kind of care is not built, we'll just be running as if we're operating a mechanical system. So leadership that delivers results for its people, I believe, is visionary, it is ethical, it has the ability to execute and evaluate, and it is empathetic towards the needs and concerns of its people.
So envision, ethical, execution, and evaluation paired together, and then empathy. Of the four, which one do you think we lack the most at this time?
Good question. I would settle on execution and evaluation, because I think that not just in our country, but across Africa, we can't say that there's a depth of intellectual or competent leaders in thought. There's a lot of thought leaders, there's a lot of policy prescriptions. In fact, if you look at our books, you see a lot of great ideas. I think where the nexus hasn't been established well is with the execution. So how do we frame the vision such that when we are implementing it looks different? Or is it that our research is not strong enough or relevant enough? Or are we using examples that we haven't done enough local research such that the basis of our theory is from another ecosystem and it doesn't translate well here? So all of those have to be looked at. But if we get the execution and the evaluation right, that if you're even doing it, evaluating to see whether this thing that I set out to do is actually giving me the results that I thought it would give me, so that I know when to pull the brakes rather than throwing a lot of funding and then it goes down the drain.
Let me pull the brakes now and move on to evaluation of our health and wellness.
It's a nice way to segue into
Indeed. So let's, for the benefit of someone listening, I mean, just to give us a contextual framework, when we say health and wellness, what are we looking at? What are the components? Where should our interest be?
We work with WHO's definition. They give us a certain definition that hides nothing. They say it's a complete state of physical, mental, and social well-being, and not just the absence of disease or infirmity. So that really encompasses everything.
It's a complete state of mental, social, and what?
And
physical well-being.
Physical, yes, physical, mental, and social well-being. You know, some would even break it down to include spiritual, as well as financial and intellectual, depending on who you're reading. They would have either 7 divisions or 5 divisions or 9 divisions, but it brings health into total perspective, that it's not just physical, it's not just the absence of disease, deformity, absence of discomfort, but a real state of total wellness. You may be physically well, but are you emotionally well? Are you mentally well? Are you and these days, the question to really ask is whether people are financially well.
Indeed.
Because there's something they call menyaren sumentiapo. It's pocketitis.
Wow.
But the pocket is...
Do you have people coming to your consulting room and spending more time telling you about the financial problems than they are?
Yes. It sometimes gets into discussion, especially when they have to do investigations. Then it gets into discussions on cost and how that times are hard, and yeah, so that affects mental health, obviously.
Let's talk about awareness. It would seem that people are often unaware of their own bodies and cannot even sometimes tell when something is wrong with them. They only respond when there is a malfunction or failure or crisis. What should we know generally about ourselves?
Well, there are a number of things that for the non-technical person, I think everyone should be interested in. You should be interested in certain vital scores, like your blood pressure. For an adult, you should have an idea what your normal or average daily blood pressure is. You should also have an idea of what your sugar level is, what's a specific test that we do. That's a test that probably has to be done in a healthcare facility, or if somebody needs to do it more often, they are taught to do it. But at least once in a year, if you get to know what you're doing, it's useful. And then depending on your gender, and age as well, every male above 40 must be interested in knowing what their prostate PSA score is, and so prostate health and function. And then every female as well must also be interested in cervical cancer screening, and of course, because cervical cancer, one of the 2 leading causes of cancer-related death and mortality in females. And then, of course, there also breasts as well. So these numbers on BP, numbers on sugar, they should, and then even how you're faring in terms of BMI, because that also eventually leads to some metabolic disorders. So I'll prioritize for everyone the first 3: BP, sugar, and BMI. And then for age specific, we'll look at the prostate, the cervix, and then the cervix for cervical cancer, and the breast to rule out lumps and breast cancer.
So these are figures that you're saying a person should should be familiar with, especially as they grow. And in the course of your presentation, you mentioned at least once a year. Let's talk about routine medical checkups. If you drive a vehicle, if you bought a brand new vehicle from the manufacturer, you are told, listen, after 5,000 kilometers, bring it.
Come back.
After this number of months, bring it to us. Let us screen it and check the various functions. When it comes to our human bodies, there are all kinds of thoughts out there, but let's stay with the issue of routine medical examination or checkup. Should it be compulsory? Should it be something that a person should have as their logged down assignment every year or every 6 months? What's the practice or best practice?
So, answering the first question, I believe strongly it should be, because what is turning out to be the case is that there is an upsurge or an increase in what we call the lifestyle-related diseases. If you like, I think the current statistics is indicating that about 46 million of the deaths that occurred in the past year across the globe are attributable to non-communicable diseases, and these are diseases like cardiovascular-related, diabetes, cancer, chronic respiratory conditions. So these ones, for instance, are things that something can be done about it if it's found in time. But the challenge is that most people are discovering it very late. And so the burden is even worse in developing countries, where we, because of course, financial constraints and poverty, people even show up very late. And sometimes the first time they are presenting is when they already have a very severe complication or death. So if we're going to be mindful about how well and how not just how long we live, but how well that the quality of that period is, then we need to pay attention to screening. It gives us the early telltale signs so that we can make intervention if need be.
You know, talking to people, I interact with people a lot and try to find out why people do what they do. That's what I do. I mean, that's what I'm doing now. And I find that many people's biggest resistance when you ask them to go and check is the fear of knowing. Is there any merit in that? As if, like, if you don't know, the thing will disappear. I mean,
well, we say that there's this adage that what you don't know can kill you. Can kill you, but actually it's even more dangerous, because what you don't know, you can't get help for. And as I keep harping on the non-communicable, the cardiovascular causes of death. For instance, hypertension is silent. If someone has hypertension, generally for many years they have no symptoms. When you begin to have symptoms, then it means that you are getting into an emergency. You are developing something that could be almost lethal or fatal. So people should make it a practice that and especially for those who say, oh, me mentanyare, or for me, I don't fall ill or sick often. I have great health. There are those that we are concerned about, because they may come in when everything is gone flat, when they've lost the window where we could have implemented prevention or correction, and then it now becomes curative. So in a year at least, and sometimes even most HR policies require that we do these screenings, but people just don't commit because of, first, the anxiety, the fear that what would they find, and then also, well, I feel I'm all right, it's a waste of time. I would just be, it's almost like doing an insurance policy. It's until you have an event that you see how important that insurance policy is, but most times it's a painful for people to pay. They only do the motor insurance because the law requires it. So maybe we, as a matter of policy, we should be looking at making it compulsory for every workplace to insist that at the beginning of the year, or maybe people should tie it with their birthdays, but it should be a personal goal that if you want to live long, it shouldn't just be living long, but living in good health whilst living to a ripe old age.
So you are saying once a year, and if you think you will forget, tie it to your birthday.
Absolutely.
So every birthday month or week,
yes,
you go for that medical examination. I read a report yesterday that suggested that from the National Health Insurance Authority that suggested that 48% of adults don't visit the hospital at all. That's probably 1 out of 2. Don't go to hospital at all. And the part that was very interesting, it said that men are more guilty than the women, and that men often only try to get help when it's almost too late. And somebody said it on the show a year ago. Will that be the case, and if so, why?
It's spot on. It's spot on. And I can share with you statistics or data from my own hospital for the past 3 years. The data suggests that we have a higher female attendance than male, and it's actually averaging for the last 3 years 69% female attendance against 31% male attendance. So it's not even that close. It's that significant. And I mean, some would say that, well, there are many more females already in the population than males, so it should be normal. But then if you look at the gap, it doesn't suggest this. Some will also say that, well, the females take care of the children. Children are usually often sick, so when they come to the hospital with the children, they take advantage of that and also present their own conditions. So that could explain that. Well, some also say that women have reproductive and childbearing needs that take them more. But there have been studies that have discounted all of these and made it an even playing field, and still found that between the ages of 19 to 59, that the health-seeking behavior is better in females. And the reasons are, one, actually, that there is some part of the male constitution to be, bullish about things. Oh, you have a pain here, so it's normal. You have to be a man. How can a man just go to hospital simply because he has a headache? So it's a bit of male egoism there, and also a bit about, well, it's a waste of time. I need to go and make money to provide for the family, and I'll lose that time when I'm going to the hospital. There, some also a bit about, again, the male constitution that does not like taking instructions. So if I go and then they tell me to do, they are telling me how to live, what to do, etc. An independent studies also actually found that when you come to a hospital, the level of compliance, the females comply more with the directives that they are given than the males. So if you put all of that together, I'm not surprised that we're seeing this situation play out.
This is Springboard University. My guest, Dr. William Okyere-Frempong, helping us to understand our bodies, how to manage our bodies like a brand new car that God gave you. And he is suggesting that every year you make it a routine to go check on your medical condition with a professional place. And when you go, some of the things you should be interested in, especially as an adult, include your body mass index, your blood pressure, your sugar level. He says these are basics. And then also, as you grow older, be interested, if you're a woman, in your cervical health or cervical cancer tests, and then also your breast care. For men, it is the prostate. So these are some basics that you should be familiar with. But all in all, he's saying, he's confirming that men tend to have more inertia about getting help because we tend to feel that we are on the go, it's a waste of our time, we don't want to comply, while women tend to pay more attention earlier on than when waiting till things get out of hand. We'll go for a break. When we come back, I'm going to ask about the budgetary implications of our inaction. I have a feeling that is where people will sit up and say, what? No way. We'll find out how the choices you make have an impact on your health and how your health has an impact on your budget, especially as you get older. Please don't go away.
There once was a man who had it all. He had skill, he had charisma. He was loved by all, but above all, he knew the importance of helping others, lifting others up. He knew the importance of giving other people an advantage so that they too would use that advantage to help others. All you need is that advantage that sets you apart from the rest. And when you discover that advantage, life's challenges don't seem so daunting anymore. That's where we come in. Enterprise, your advantage.
Apply now for a degree in environmental engineering, fashion design, landscape design, interior design, business administration, economics, law, nursing, civil engineering, architecture, computer science, IT, theology, PharmD, and many others at Central University, Ghana's leading private Christian university. Admissions are open for the 2021-2022 academic year. Degrees are available on our campuses at Mutual, Christ Temple Abosokai, and Kumasi. You can also enroll in our MBA with various specializations. Scholarships are available for needy but brilliant students. Call now on 0303 318 583 or 0302 396 189 and speak with an admissions counselor. You can also visit our website at central.edu.gh for more info. Central University, raising transformational leaders through faith, integrity, and excellence.
Welcome back to Springboard, a virtual university, and to this conversation about managing your health and wellness, brought to you by the Springboard Roadshow Foundation and proudly sponsored by MTN Pulse, the Enterprise Group, UMB Bank, Central University, with our media partners, the Multimedia Group, and the Graphic Business. My guest, Dr. William Okyere-Frempong, reminding us of the importance of managing your body just like you manage a brand new car, taking it to servicing routinely, and he says once a year. Make it a point to take it to the medical facility to have it checked thoroughly. And he says if you think you forget, make that a birthday routine. The week of your birthday or the month of your birthday, go for that routine annual medical examination. He also says that there are some basic things that you must keep your pulse points or your eyes on, including your body mass index, your blood sugar level, your
blood pressure.
Blood pressure. I was almost going to say hypertension, but that's not the right one. Your blood pressure level, yes. And then as you grow older, for men, your prostate, and then for women, cervical health, as well as your breast care. William, do you think that a more empathetic, to borrow your word, empathetic approach to medicine, where the doctor connects better with patients, explains things better, looks pleased, not just doctors, but all caregivers, show more empathy, will encourage more people to go to the hospital. Because growing up, many people said they didn't like one subject or another because the teacher was not friendly or did not teach it well. Do you think there must be a paradigm shift in the relationship between caregivers and patients?
Absolutely. On both, I agree on both counts that the patient's health-seeking behavior would improve if there's also a good relationship with the provider, and then as well the need for us as we practice medicine here to keep improving our engagement with clients. I know that for those who seek healthcare from the private sector, there's a lot of more cordial engagement. Primarily, the challenges with the public care facilities, and it's not because there are no great doctors there, but sometimes there's a need, there's a pressing need to balance the numbers and the time available, so that if you started your clinic already and you see that there are 100 people behind your door, to have a meaningful engagement with each patient, even if you were doing 15 to 20 minutes with them, that translates to 20 times 100. That translates to some 2,000 hours.
That's practically impossible.
That is practically impossible. So it creates the constraints. But as there are more and more professionals available, that should keep improving. And also, I think that every patient going into a consulting room should know that it is their right to know. And I would not think that if anyone asked a doctor to explain, that there'll be a pushback. But if you came in and didn't ask, when he also thinks about those behind, he will just say, well, let me see the next person then. So it should be a two-way streak. As the doctor should be conscious of the fact that those who come in, especially in our parts of the world, see him as the lord of the space, and they are even intimidated by that person, so they may not ask questions. So at least have one or two lines to simplify what is happening and what the patient should expect. But also the patients should also engage and say that if there's something they need to understand, so that for those who are pressed with time, at least they can prioritize those who also want to know. But I agree that we need to keep improving, and customer service perhaps should be an integral part of medical education. And for me, I think that's where it begins from. If we're intentional about how we teach those who are aspiring to become doctors how to engage the patients meaningfully, it will begin to signal a change, that there's a new wave of doctors who are more willing to, and do not get angry at you throwing Google at them.
Yeah. One doctor told me that, Charlie, can you imagine? She actually told me that my reading was wrong. And she was looking at her watch, the reading on the watch against the one I had given her. But let me go on to the biggest issue that is on my mind as we have this conversation. And so this whole year has been about the choice you make spiritually, the choice you make professionally, the choice you make financially has implications. So let's settle on the choices that we make in terms of our
health-seeking behavior.
So no, in terms of our lifestyle,
okay,
and the link between that one and our health, and the link between our health too and our finances or our budget. Because I am very certain that once we establish the link, many people will take this conversation a bit more seriously. So draw the line between the things we do, the things we eat, the things we do on a routine basis, and the state of our health, and by implication, the state of our economic or financial well-being?
Well, one will not struggle to see the link. In fact, let me begin with this statistic that I came across. 41% of the working class, that was done in 2017, 41% of them were found to have retired earlier than they had planned. Out of that 41%, 1/3 of them was as a result of ill health.
Wow.
So what it means is that their financial situation would have obviously worsened. So, and how does that translate to lifestyle and choices? I gave an earlier statistic about that from the WHO that suggested that about 74% of global deaths are attributable to non-communicable diseases. So non-communicable diseases are now the main cause of disease and mortality. If you look at the OPD attendance, if you look at especially that the causes of death, you'd find that increasingly we are having infectious diseases come down. Infectious diseases that can be transmitted from one person to the other, and then we are now having these non-communicable ones, the hypertension, diabetes.
Oh, I'm now building the link. So what you're saying is that typically on a regular day when you sit in clinic, more people come with diseases that are a result of their lifestyle than diseases that were communicated to them by somebody
parasites,
else infecting them.
Yes.
Wow.
Yes, and that's globally, that's the trend, and actually it's worse in developing countries.
Why?
So we are suffering a double burden of both infectious and lifestyle-related diseases because, for instance, if you take our healthcare system, it's not as at the state of efficiency as you would have it if you were in the developed world. So that becomes one detractor. The next is our lifestyle habits have changed. The habits have changed. We are more sedentary. We are eating more quote and unquote junk. We are also experimenting with a lot of things. There's a lot of pollution in our environment. And then if you cap that with the fact that you don't have a great healthcare system, then you would have this complex where your health is declining.
So you're saying that there must be some physical activity.
Yes. So
how much of it? Or
so
what would you recommend?
Physical activity, junk, and then the foods and the meals. We can focus on that. So physical activity, the recommendation really is that if you could do 30 minutes 3 times a week, 30 minutes of exercise 3 times a week. And here I will need to add that exercise that leads to you, let's say, physically sweating. So it can't just be, oh, I'm doing a walk around my house, but it is at such a leisurely pace that it does not engage the body fully. And swimming could also be a very useful alternative as well. But in the minimum, these days, if you go online, you find a lot of videos on exercise routine. So if you subscribe to any, or there's a television channel that you could work out with in the morning, some aerobics, get yourself sweating, get the heart pumping. It's really not about, the focus there is not about doing that to lose weight, because that's when people get into that regimen, but just doing that to stay healthy and fit. A good friend of mine, a nutritionist, who gave me a rubric that is great for patient communication, and he says that your meals must always be A, B, C, D. So the A, and this is credit to Nana Kofi Owusu. He says the A is that you should ensure that your meal is always adequate.
Okay.
So adequate in terms of the
portion,
the the portions, so it meets your daily caloric needs. There are some who, by reason of the work they do, if for instance you're into manual work, you're digging, construction, your breakfast may not be a typical English breakfast because it will not suffice for your needs. But so the one who does sedentary work does not need a lot of that calorie. So if you started with a very big, bulky breakfast, then you are not, you are being disproportionate. So it should be adequate for the body, for the age, the physical activity, and the daily needs of the person. So that's A. Then B, it should be balanced. Balanced means that it should have a fair representation in adequate amount of the various food groups. So it should not just be a carbohydrate-based diet. I listen to a radio station, and there are some people who contribute to sports. There's one who says that his name is Wache 5CD Shitong.
It's been trending for some time now. I think that beyond the laughter and everything, I recently heard somebody say that a vendor had made a statement that should the economic challenges continue, now when you buy rice, you have to buy the stew separately before you even buy the meat. So the Shitong is like saying, you can't even afford the meat.
So it has to be balanced. There has to be vegetables. There has to be, and we don't do a lot of vegetables in our parts of the world. So right. The balance has to be there. And then C is for control.
Okay.
Control means that there should be a stop and start button. There should be some rhythm. There should be breakfast, there should be lunch, there should be supper. It's not continuous eating. Okay. So there's some that eat every time. There's no restriction. You must be able to control when you are eating and also how much you are eating. The times where food is served, and it's almost like the proportions of everything is out. It's like the fufu is there, and it's almost like it's a zoo. Fish, there's everything there. You can see there's.
Give me the D, and then I'll tell you something about this zoo that you described. So the D,
the D will be diversity.
Okay.
Diversity means that, and diversity comes when we plan our meals, because when we wait till it's meal time before we ask what would we eat, we would literally go for what is closest. Okay. What happens is that then we repeat the meal. So it's everyday fufu, everyday bangkun. You can do bangkun or kinki water for breakfast. Shinti for breakfast, it does kinki in the afternoon for lunch. Kinki. What it does is that then you are not exposed to all the other nutrients from different sources. And when you do these ABCDs, you provide your body with all the nutrients it needs, including all the micronutrients. So you don't need to do food supplements because the body is able to get it from all of these. The challenging thing is that these days the spices that we grow, the condiments that we used to add to our foods, they're no longer available. The coincide, the srowesa, the fomwesa, the kakadros, all of those that we use naturally, we are going for the artificial flavorings and things like that. But if we ensure that we have all of these, we respect these rules of A, B, C, D, our dietary intake our food intake would be more wholesome, and then our health outcomes would also be better.
I know it won't be your area of specialization, but I just can't help but take a minute to touch on the issue of environmental pollution and its implications for our health, either through the food that we eat, the water that we drink, the air that we breathe, or just life around us. Can we steal a minute of this conversation to address the issue of the pollution of our water bodies, the improper disposal of waste, and all these things, and how they end up impacting our health?
As we talk about this, I just hope that, especially in our country, that we get to a point where we can have a lid on galamsey, for instance. Water is so essential to life. And I listen to radio and hear people who used to farm in areas where they say that they now fetch the water and use it to water their crops, and the crops are rather dying. It tells you how the quality of that water is getting affected. And when we say, for instance, somebody has typhoid, for instance, typhoid is transmitted fecal-orally. So it just simply means that you've eaten someone's feces, literally. The processing of food, the way things go through, the way we pollute our environment, all goes out and comes back to us. So we need to be deliberate about saving our environment, not just because it is a nice thing to do, but actually it is saving us, because they have said before that when the last tree dies, the last man will also go with it. And I say that when the last river body in Ghana runs dry, all of us also go with it.
In mentioning what changes we must make to our diet, you left out water. So let me, since you're talking about water and it being essential, I guess the conventional wisdom seems to be that the more water you drink, the more it washes your system, as it were. Correct?
So everything still respecting the ABCDs, inadequate amount.
As we wrap up this discussion about health and wellness, what is the one thing that you want to see as a starting point for a healthier nation?
Well, I want to see people respond better with their health-seeking behaviors. So they make an annual health screening a part of their annual to-do things, and do not wait to present at the hospital only when they are ill. And that they themselves will also be intentional about actions and activities that promote prevent ill health. So they're exercising, they're eating well, they are keeping their minds active, they are taking the necessary vaccinations, because thankfully the advancement in medicine and science is providing us with some things that help us sleep better. So there are lots of vaccines that are available that you can take that give you a certain assurance that if there is this infectious agent around, that at least you have some level of protection. So if people take the preventive measures more seriously, it will help. And then also as a nation, the health promotion practices. Health promotion practices, which will be our communication on risk behaviors, on alcohol use and abuse, on sexual behaviors, on things that we can educate people to shift their health, their behaviors that lead to ill health. So promote good health practices. So, and then we can also now look at the preservation. The preservation comes in with curative, so where you are ill and you are seeking proper treatment, not talking to a friend and say, oh, when I had this, they gave me this. So you self-prescribe, you self-medicate, and yet you don't know what dose is good for you. And then also rehabilitation. There are times when restoration is not fully possible, or that it would be possible after a longer period. So there is rehabilitation as well. So if as a people, as a nation, if we focus on these, increasingly we'll be seeing people live longer but also healthier, where they have attention to things that prevent ill health. They're eating well, they are moving well, they are engaging in, they are vaccinating, to protect them and prevent them from diseases. And then also they are being reminded about the dangerous activities and practices that eventually would lead to ill health. And then we are also implementing policies. For instance, there are countries where there is all the saturated fat we are talking about and junk food. There's junk food tax, and it's intentional because they want to reduce the burden of NCDs or non-communicable diseases, because it costs the nation to treat that. So if there's tax, then people go for that, go for healthier options more. There's all of this communication around that. Then plus, lastly, we look at the curative, that if you're ill, you must report to a competent provider who would be able to effectively diagnose and then treat the condition in order to help restore your health. And if that also needs rehabilitation as well, in order for you to cope with the situation that has emerged, then you do that.
William Okyere-Frempong is a medical practitioner. He's a leadership expert and also a certified coach, trying to help us unpack the management of our bodies. If you've been listening, he started by talking about what he thinks the continent needs at this time, envisioning ethics, execution, and empathy. He says the execution is the missing bit. I think the empathy is the missing bit. Because when you have empathy, you do all the other three. Well. But that's my own opinion. The second one, he says, the WHO defines health as a complete state of physical, social, and mental well-being, not just the absence of disease or deformity. But he's saying that these days the definition of physical, social, and mental has been extended to involve spiritual, financial, especially because, Charlie, you can't avoid that one. The third one is about awareness, and he's reminding us that many people don't really know their bodies, and he's saying at least at the very basic, know your BMI, be familiar with your blood pressure levels, and then also your sugar levels. And as you grow older, for men, be interested in your prostate, and for women, cervical health as well as breast care. The next point is about routine medical examination. He says 46 million deaths are from non-communicable diseases like diabetes, cancer, hypertension, rather than those that are caused by the viruses that are transmitted from other people. And that means that something that we are doing, we should be looking at ourselves a bit more. And he says that the danger about most of these things is that they are silent. And so if you wait for the symptoms, by the time you come, it's getting too late. Why do men seek help less than women? And he says it's simply because men sometimes think they don't have time, or they don't just like to be vulnerable, or there are financial considerations, among other reasons. But those are the reasons why he tends to see more women in hospitals than men. Interestingly, he says between the age of 19 to 59, he has 69% of women and 31% of men coming to his own practice. Should there be a paradigm shift in medical practitioners versus patient care? He says, obviously, the more people feel that they are being carefully handled with empathy, the more they open up and the more they would like to seek medical care. But he says, as a matter of fact, there tends to be a much more empathy in private practice than in the public centers, partly also because of the sheer numbers of people that the caregivers in the public sector space have to see to. That doesn't allow for as much engagement as the practitioner would like. And then the last big point is about the link between our choices and our health state, and then also our finances. And you see that of the 41% of working people retired
retired earlier than
they had intended. And out of the 41%,
a
third of them was for health reasons. I calculated and I said that's about 14% of people retiring early because of health reasons. That means that the income stopped flowing, not because you wanted to, but because you had
just
to.
Couldn't.
And that was critical. You end by saying, let us be more deliberate about prevention, promotion, and preservation. And in between, you talked also about what we should eat, the ABCD of what we should eat, and then also how to take care of our environment. William, the gratifying thing is to get a testimony about somebody who's gotten a solution, a miracle, a lifestyle change as a result of the preaching or the ministry. For the teacher, the students' results and they passing their exams gives them that fulfillment. For you as a medical practitioner, what is that thing that gives you the feeling that, yes, we got it right?
Well, the story of change.
Give me one.
So I'll share one of someone who by implementing lifestyle changes, I mean his whole being transformed.
Right.
His weight was over 150 kilos.
Wow.
And such that he even developed visible breast, and this was a male. And he tells me that his friends called him Breastina.
Oh.
Because he had, this obvious mammary glands that were more pronounced than they should have been. And by implementing lifestyle changes, exercise, dietary management, he now moved from this over 150 kilograms to under 70.
Wow.
And then now he had these nice trim chest of 6 packs, and he's now a chestina.
Oh, so the friends now call him chestina.
So he moves from breastina to chestina. And the interesting thing is that he says that, and this is someone who's published this in a book, so he's now even earning money from his experience, and actually now a certified weight loss instructor, and he's teaching people how to deal with that. He talks about how his self-worth, how it improved greatly. And so it's actually not just physical, but it's also emotionally healthy as well.
I believe you so much. So what you're saying is that just by changing his lifestyle, one, he's trimmer and fitter. Two, there are health implications for his own body and appearance. Now the friends are also calling him chestina instead of breastina, and then now he's written a book about it. He's earning income from it, and he's become an instructor to others also about how they can get a better life. Thank you so much, Dr. William Okyere-Frempong, and let's do this again.
My pleasure. Thanks, Albert.
This has been the breastina to chestina edition of Springboard Virtual University, talking about managing health and wellness. I trust you found some useful nuggets for charting your way forward. Till we come your way again next week with Springboard, your virtual university. My name is Albert Ocran, thanking you on behalf of the Springboard Roadshow Foundation, our sponsors, MTN Pulse, the Enterprise Group, UMB Bank, Central University, and our media partners, the Multimedia Group, and the Graphic Business. Till we do this again, my name is Albert, saying God bless you, and God bless you.